Welcome. My name is Kathryn Meyer, and I'm an attorney at the Center for Children's Advocacy. I'm part of our Medical Legal Partnership Project at the Yale Child Study Center. The Center for Children's Advocacy is New England's largest children's legal rights organization. We are a nonprofit law firm, and we provide legal representation and advocacy to vulnerable children in Connecticut. Our staff is located in community sites throughout Connecticut, including hospitals and schools. And our work brings us into the courts as well into child welfare and juvenile justice facilities. And I'd like to extend special thanks today to the Connecticut Division of Public Defender Services, who is sponsoring this event. So a few logistical points. Please, of course, keep yourself on mute when you're not speaking, though do feel free to drop your questions into the chat at any point. We're going to do our very best to weave them in throughout, but we have a very packed agenda, so we'll do the best we can. And this webinar is being recorded live. It's being streamed on CTN. We will also email participants a link to the recording shortly after. So the plan is that I'm going to present a brief recap of each bill and just try to hit the highlights. And then I will pass it over to our appropriate panelists to comment on their reflections from the session, highlight other things that I might not have gotten to in the bill, maybe elaborate upon the provisions, talk a little bit about the process and kind of what the experience was like, and then share plans for next session, advocacy points, and kind of get re-energized for the next session. So I think we're ready to go. I'm going to start off with juvenile justice, which is obviously a very, our speakers, I probably should do that. Thank you. Our speakers today, we're going to be starting with Representative Robyn Porter, who is our Connecticut State Rep from Hamden and New Haven. She also serves on the Appropriations and Judiciary Committees, amongst other committees. We have Dr. Yann Poncin, who is a child psychiatrist from the Yale Child Study Center. He wears many hats, which he will share when he discusses his roles today. We have Melanie Wilde-Lane, who's the director of the Connecticut Association of School-Based Health Centers. We have Andrew Feinstein, who's an attorney and the founder of the Feinstein Education Law Group, who also sits on the executive board of SEEK, which stands for Special Education Equity for Kids. And finally, we have George Sinclair, who is the Communications and Government Relations Associate for the Connecticut School and State Finance Project. We have a lot to get to. We're going to start off with juvenile justice. We all know this was a quite hotly debated topic this session, and that Republicans came in with an agenda to roll back some of the progressive reforms that have been in place in our state for years. Juvenile justice advocates were poised to defend those reforms and really kind of hold strong on the Connecticut juvenile justice system and what it stands for. Republicans wanted to pass measures to address what they described or they characterized as a spike in juvenile crime, particularly in juvenile car theft. And they wanted to attribute that or show a connection between that spike and Connecticut's progressive laws. Ultimately, that correlation was misleading, as national data showed that the uptick in 2020 reflected a national pattern, which is largely being attributed to widespread social disruption from the pandemic, the closing of schools and activities, and all the many challenges starting from that year. And early 2021 data so far is showing us a decrease in stolen cars. And hopefully that pattern is going to continue. So just a few highlights from the bill, HB5417. And just going to reflect upon a few of those provisions and then hear what Rep. Porter has to say. And thank you, Stacy dropped the bill into the chat. I should say some of these bills are many, many pages, particularly when we get to education and mental health. So we only have time to try to highlight. So definitely do your research and check them out yourselves. So 5417, one thing it does is shortens the amount of time before a youth that is arrested is arraigned in court. It lowers the standards for detaining a child and increases the time that a child can be held while awaiting a detention order. It broadens law enforcement access to minor records. And finally, another main point is that it allows a judge to order a child who is charged with their second motor vehicle offense to be electronically monitored. And then a violation of that monitoring can result in immediate detention. So Rep. Porter, as our expert today in the legislative process and our juvenile justice expert, would like to hear your initial thoughts on the bill and your reflections on the session and the process and what you'd like to see happen next session.
Thank you so much, Kathryn, and thank you for having me today. It has been a whirlwind of a session, and I can say with the juvenile justice issues and reforms that were presented, it was and still continues to be disturbing to me, the reasons why we choose to move forward the way we do and express a sense of urgency when that sense of urgency has existed in my community for decades. So you talked about, the child who was arrested and charged with delinquent act must be arraigned no later than the 5th day. And I can tell you when this bill was being not even called yet, as a matter of fact, I was receiving several calls from stakeholders, from personnel with state agencies that we deal with, CSSSD, the Public Defender's Office. And I'll say first that the concerns really did weigh heavy and they made practical sense to me. I think that a lot of times there are knee-jerk reactions, and that is what we saw with the heightened or perceived heightened carjackings that were going on. And at the end of the day, you mentioned some of the things, but I also wanted to mention something that kept coming up, particularly around juveniles and car thefts, where there was always the mention of, key fobs and the fact that technology with cars have changed and made it easier, right? And thefts, whether it be cars or data or intellectual IT properties, whatever it is, they're very crafty and they're always looking for a better way to accomplish what it is they're trying to do. Criminal minded is what I call it. And I think that we've gone a step or several steps backwards. Connecticut was known for reform. And I think that when we look at what needs to be done, I would prefer us to look at prevention, preventative and restorative measures versus what I see in this bill as reactive and punitive measures. And there were several testimonies that came in during this that didn't support this as well. And I think their concerns were quite legitimate as well. And I can remember, I think it was Sue Hamilton, she's the director of the Delinquency Defense and Child Protection Division Public Defender Services. And she actually made some really great points around the assessment piece and how that would be required immediately upon arraignment. And her concerns were that the court, she made note that the court already has the authority to issue electronic monitoring when a child is released and placed on suspended orders of detention. And she also was in opposition because the children could be held longer than 6 hours. And the bill is increased to 8 hours. That was concerning for her. And then the other thing that I really wanted to mention that was concerning to me was the efforts around the GPS monitoring and how, I had conversations and received calls from, CSSD and was provided information. So I just want to kind of put things in perspective as to why, I also see issues with this bill. And they were validated by the fact that, they currently have 0 kids under GPS supervision, that it's not their custom to use GPS supervision, and that they had currently, and this was at the time the bill was being debated, 74 kids under electronic monitoring, right? So those numbers have been consistent, he said, within the last 3 years or so, and that they may have this was 50 at one time or as high as 90 to 100, but they are usually 5 to 7 juveniles on electronic monitoring at one time. And he thought that they use electronic be put on rules. Another instance would be if there was a single parent who's working a second or third shift and they wanted to ensure that the child was home, right, when mom, dad, or the guardian was at work. And then part of the graduated response protocol when the kid is not being compliant with their supervision conditions. And to further bring the point home, there's no data that actually supports that GPS monitoring is effective, that it curtails the things that we're trying to curtail. And I don't think, because I've talked to some of these juveniles, that they would be deterred. If you're determined to commit a crime, you're going to commit a crime. You're going to take the GPS monitoring off. You may just do it with the GPS monitoring on. There are concerns around the accuracy of GPS monitoring. And then also the concern, we talk about the impact that it's having on the juvenile, but there wasn't much discussion around the impact that it has on the family as a whole. And when you have a child that is under this kind of supervision, how it impacts the everyday operation of a home. And, a lot of these kids are coming out of single parent homes, which makes it just that more difficult for the parent or the guardian to do what they need in order to try to help with the situation. I think the other thing that concerned me was the special juvenile probation, because I've seen this used with adults, and we talk about how we have decreased the population in that we incarcerate in the state, and that is true. But we've gone from incarceration in prisons to incarceration in communities, and I don't think that is something that is really being examined. And at the end of the day, overall, this bill, Kathryn, I believe, didn't take a deep enough dive into providing the resources and funding that is needed in communities, especially distressed, marginalized, criminalized, demonized communities, where we are criminalizing childhood behavior, we're criminalizing poverty, and we're talking about, in the same breath, eradicating crime. And I don't think that you can do that unless you're talking about addressing the issues of poverty that are rooted and grounded in substandard education, lack of jobs, healthcare. There's so many prongs that go into this. And I think if we talk about what is missing, that is really what's missing. Looking at this from the root and not the surface or the symptoms that come about. And I feel like we've taken a Band-Aid and put it on a gaping wound. And I believe that in time, it will show that there are better ways that we could have done this and we should have done this. And what I'm hoping we do next session is that we revisit this with a lens that is more inclusive and more engaging with the people that are being directly impacted on both sides of this equation, not just the victims, but also the offenders and their families, and that we take into consideration that many criminals have been victims themselves, and that is conducive to the community and the environment and the social constraints that they are birthed into. We talk about a school to prison pipeline. I go as far as to say it's a crib to coffin pipeline, because it is structural and it is racism. And that is the other thing that we're not talking about that deeply disturbs me. Because when you look at what's happening, it only becomes a sense of urgency or need to do something ASAP when it hits a certain demographic. My community has been dealing with this for as long as I've been alive and prior to my birth. And I'm closer to 60 than I am 50. So we're talking several decades of this. And justice is not equal. Let's be honest. You can have a Black or brown child from an urban center, and then you can have a white child from a suburban area. And we know that justice is not going to look the same. So as people are pushing, for more punitive measures to address what's going on in the juvenile justice system, we have to be honest about how that justice is being delivered and who is really being punished and who isn't. And at the end of the day, that is a big reason why I couldn't support it. And I did find it really interesting that when it came out of the Judiciary Committee, that there's 39 members on that committee, 35 people voted for this, and 4 people did not. And the 4 people that didn't vote for it were all Democrats. And I found that to be very interesting. So, I mean, there are the subliminal things that go on, and then there are the processes that go on, you know, behind closed doors. And I hope that moving forward, Kathryn, that when we look to strike a quote unquote bipartisan piece of legislation, that there are more lawmakers at the table than were at the table when this bill was drafted, crafted, and released to be voted and moved on.
Thank you, Representative. It certainly seems like this bill was born out of public pressure, suburban pressure, and it feels like suburban communities, like you said, felt an experience that other communities have already felt in being victims of crime, and that provided a lot of pressure to lawmakers. But you know, at what cost? I also think one other thing to highlight is that there is a perception, or there's a rhetoric out there, that the police don't have what they need to do their job, or that, you know, that we're soft on crime for juveniles. And I think a lot of public defenders and a lot of people in the justice system would say otherwise, that there is still the ability to, there are still those tools to make, you know, to make sure that the justice is served. But there are processes that you have to go through to do that, in order to, for example, detain a child, or to obtain records, or to investigate and do the things that need to be done. So I think you and I would agree that those protocols are in place for a reason, and that, you know, that they're helping to do this in a fair way.
I agree, Kathryn. Thank you.
Thank you, Reporter. Okay, well, hopefully to segue a little bit, when you're talking about resources and we're talking about what children need to thrive, hopefully our next topic will get to that point a little bit. So we're going to pivot to children's mental health. Thank you, Leanne. And this was one of, as we know, one of the Democrats' hallmark issues this session. There's three different bills, mainly three different bills that accomplish different pieces of this agenda. And we have three experts that are going to comment on the healthcare and education implications. Some of the main areas addressed by these bills, thank you, and there it is in the chat if you want to click on that and link the whole bill. And these three bills together are about, I think, 300 pages. So, you know, a lot of reading to do there. The main areas addressed in these bills are kind of some of the main themes, including increased funding to the highest level of mental health care, inpatient beds, and increased funding to school-based mental health, which would include school-based mental health centers and school district mental health specialists. So we'll talk about the differences between, you know, the distinctions between those two entities. We're going to start off with surveys and grant programs. And there are two different provisions and two different bills that address this. And so the goal of these surveys is to ascertain the mental health professionals that are currently serving the school community, figure out kind of the ratios, figure out the types of services offered, figure out if there's any outcome data on those services, and then, you know, calculate ratios. And SDE is supposed, the State Department of Education is supposed to administer these surveys to the districts. And then both of these provisions have an accompanying grant provision. And so that's in order to fund additional professionals that might be needed and that might be uncovered by these surveys. I'm not sure if we have enough information about how those grants are going to be funded or how they're going to be given out. I think that might be an open question, but obviously the intention is there to increase the mental health professional access for kids at school. The second thing that I wanted to highlight that, of course, Melanie will be able to speak on much further is in SB1. We have the school-based health center expansion program, and that's going to expand the number of school-based health center sites and the types of services that they offer. SB1, a few other things I wanted to mention. SB1 adds slots to early childhood programs. It provides a boost to the minority teacher recruitment and scholarship program. It codifies remote learning for K through 12 students. And it also officially raises the age of special education to age 22, which is pursuant to a court case. I'm going to go into a few highlights of SB2, which which includes a grant program for expanding behavioral health care offered by pediatric providers, and also a grant program for community-based providers to provide services to the uninsured. It also includes expanded access to telehealth services. So I look forward to hearing from Dr. Ponson about how that'll affect the folks that his agency serves. Finally, to hit the high points of HB 5001, starting with the mental health components, this more strictly mental health components, and then I'll move on to the education portion. So of course, again, these bills have a lot of overlap between themselves, and then within each bill, there are some provisions that apply mainly to school districts and the State Department of Education, and there are some that apply mainly to providers and community-based organizations. So doing our best to parse that out. So the mental health components that I wanted to mention is that the bill allows for an increase in the licensed bed capacity. It creates a repository and a data collection on the outcomes for children who are accessing emergency mobile psychiatric services, which we will definitely talk about. It also establishes urgent crisis centers, which are licensed by DCF, and they're going to be dedicated to treating children's urgent mental or behavioral health needs. So different than the typical emergency room model. There are a few other education components that I'm definitely hoping Andy speaks to, including some new requirements for truancy interventions, a new requirement for schools to be working with a regional trauma coordinator to do some trauma informed training programs in schools. And then finally, a provision that is addressing behavior intervention meetings, which allow a teacher to request a specific kind of meeting with their school's crisis team to try to problem solve and wrap services around the child. And this is a separate process than what's already in place with special education, for example. So I think what I'd like to do is start with Dr. Ponson, see if he can first kind of lay out the landscape of the children's mental health crisis as we know it here in Connecticut, which we know is kind of the overlay for everything we're really talking about today. So we'll start with Dr. Ponson, and then we will move on to Melanie and Andrew.
Thank you, Kathryn, and hello, everyone, and pleasure to be here. I think what I'm about to say is a reiteration of what many have you heard and many of you have been working on in the last year or so. So I think to give the broad perspective, we are, the mental health system is a boa constrictor swallowing a hippopotamus, and I think and the question is are there more hippopotami to come along the pike, or was this a particularly bad year during the post-pandemic era? And putting our heads in the sand is probably not a good plan. So I think that making efforts to improve the continuum of care is vital and is proceeding. What we see as the main stress points are really along the outpatient of care, the front end, the entry point into care, which I'm sure many of you heard. Families struggling mightily to find therapists and to find child psychiatrists. So those are the two core areas. At the Child Study Center, we've been serving children for over 100 years and have never had a wait list in those 100 years. And now we have a 3 to 6 month wait list, depending on the service. So that has been problematic, and we've been prioritizing certain high acuity cases, which leaves other families needing services in the background who then use emergency room services or could end up in higher level services because of that. The other problem with the outpatient services, including some of the intensive outpatient services, also having long wait lists, is kids being backlogged on the inpatient unit. So I think it's important to think that for us, the issue with and we've had many kids in the ED. We have a 25 bed unit at Yale, a medical unit, and at times we've had 63 patients with more than half child psychiatric patients. So we suffer, we have the experience. But what we found in looking at our data is the issue is not actually an absolute number of kids that are needing inpatient that is driving the incredible increase. It is the number of kids stuck on the inpatient unit or other kids needing certain levels of care that then remain in the ED or remain on the inpatient unit and then get backlogged. So the solution is less an inpatient solution and more it is getting a good flow among the streams and rivers of healthcare, primarily at the outpatient level services, and then moving on, moving backwards from that. So that's an important piece to keep in mind in terms of where the resources should go. As you know, there is also a workforce shortage, which also complicates matters. So any efforts along the workforce shortage is in some of the policies, some of the legislation includes options to expand that. For example, delaying the time to needing to obtain the full licensure under supervision as an example. So workforce shortage is a huge piece of that. Another one is the Medicaid and Husky pieces where we lose money for every kid that we see in our clinic, and we don't make decisions based on that. But if you're an outpatient private practitioner, you are making decisions along those lines because you cannot subsidize yourself. That is your only source of income. Whereas we can cross subsidize in areas that are doing a little better through the Yale system can support it, but that's not a long-term strategy even for us. This is not a sustainable long-term strategy even within our system, where we're basically not making money on every patient and spending money instead. So that's a huge problem too, which ironically, of course, the Husky kids and Medicaid have in some ways better access to the continuum of care in terms of residential level care and other services of care, transportation to IOPs if you're 12 and above. So there's advantages and disadvantages there. So I think looking at the insurance system continues to be an important piece of it. I think those are the stress points. As far as, well, I think I'll leave my comments there. I think there are other interventions, well, just a couple other comments on some of the other interventions and proposals.
Thank you. Yeah, me either. I didn't want to sit in here.
So echoey.
Yeah.
The other,
Mayor.
I'll just wait.
Listening to the new legislation on juvenile.
I think there's 3 levels of prevention. There's primary prevention where you're basically making sure people, and it's a quick simple rubric is primary prevention where you're basically preventing people from having trying to implement systems so people don't have problems to start with. There's secondary prevention where people at risk are starting to get attention. And then there's tertiary prevention, which is the people that have the problem are already being taken care of. And so what we're finding is that the kids in the secondary the kids that have a risk for mental health challenges and behaviors are starting to bubble and they can't access services. And that's a huge piece of it. There's a lot of effort towards primary prevention, I would say, which are the school-based mental health centers, which are both primary and secondary. I think more secondary, where someone is bubbling at the school and accessing services. And so I think that's going to be a helpful piece to have more school-based services. And I think I'll leave my comments there. And if there's anything specific questions, Kathryn, I can certainly answer them. But that's my big picture view.
Sure. Yeah. Before we let you move on, Dr. Ponson, can you just give, when you're talking about the hippopotamus, what, I hope I got that right. What are you seeing? What are the, we've all read and we all have experiences on this call, I'm sure, but what are the main issues that you're seeing children present with when they get to you?
Children are presenting with behaviors that they've always presented with in higher numbers and with more intensity. So in our emergency room, we have a greater number of kids who've presented with suicidal attempts, for example. So I think one thing I should make clear is that I said that the big majority of a lot of the numbers for the inpatient and the emergency room are driven by the system being stuck. But the kids that are there are actually presenting sicker than they had been before. So we're both managing a higher volume, but a population that is presenting as sicker. And by sicker, I mean We've had more kids coming in who've already attempted something rather than, and we always have kids who've attempted things, but there's a higher number of kids attempting things, more profound suicidal thinking, more existential angst around peer relationships and how to negotiate peer relationships and their identity, more expressions of gender fluidity and expression, which I take to mean as both a combination of kids are more comfortable presenting themselves that way, and also kids in general struggling with identity. Who am I? What am I in the context of the world that we live in today and the trauma that we've all been through? So I think there's a lot of symptoms that are below mental illness that drive this as well. Just the demoralization, feelings of self-esteem, where is my future, where is the future, pressures of academia, social media pressures. So there's a lot more intensity within each child coming into the building, into our buildings. And same with the parents. Parents are feeling overwhelmed and stretched and not sure how to manage and not sure where to turn. And likewise, kids are presenting with, I would say, a higher intensity of disruptive behavior. So we've always had kids who struggle that way, disruption, which is frequently driven by trauma experiences. I think we see an element of the racial inequities that drive care, including a higher number of kids of color who self-harm compared to at least data from mid-pandemic self-harm compared to children typically presenting as white. So those are some of the range of things that we're seeing.
Thank you. I think that's really helpful as we think about the legislation and think about whether it really gets to the needs of the kids.
Yeah, I would say that the focus has to be, it's hard to tug at pulling at any string in this piece is, removing one leg of the hippopotamus so it's easier to digest, just to keep the analogy going is helpful. I think that, looking at the continuum and any piece is helpful. I would say in terms of funding streams, looking at the what I call the front end and in a way lower cost areas, and increasing the strategies to increase the workforce, remuneration for services. So looking at those rates, expanding outpatient services to accommodate care. So lower level outpatient services, whether it's outpatient, intensive outpatient, that's where we're going to get the most, address the most need out there. I think it feels like the pressure is on, and I get the calls, help our ED, we're overwhelmed. So if I just wore that hat and said it's overwhelming, that's where the focus needs to be. This is a crisis, a disaster. Our ED has 63 kids. Our kids with medical traumas are in the hall. But removing just that lens, I see that problem is in part because of these other layers of problems before it or after it. So the core problem doesn't lie there. It really lies around the intensive outpatient services, ensuring that we have enough in the way of intensive outpatient services, ensuring that families in the foster care system have enough support to help with kids that are severely struggling, rather than them ending up in the ED and over again. So really having the focus and the lens more on that direction, I think is more helpful from my perspective.
No, thank you. I think that's really important. And Eleanor, thank you for the question. I'm going to address it after we talk to Melanie, because I think both of our panelists here might have something to say about that. So Melanie, what can you share with us about the school-based health center expansion program and your member agencies? How are they rolling out their plans? What does this legislation do in a positive way, and what might it have left off? And how do you think it's going to be ultimately helpful for Connecticut kids?
Sure. So initially back in 2021, legislature passed legislation mandating that a work group was put together and comprised of stakeholders identified by legislators and by the Department of Public Health. And so we spent a whole year working together on identifying areas, towns, schools that had really high needs, and that was based on many things, but primarily on a social vulnerability index. And so what came out of that was that 11 towns were identified as being significantly high needs for mental health. And specifically, if we drill down, there were 36 schools that were identified in those 11 towns. We took it a step further and identified 124 other school sites that were secondary, and then another 157 sites that were tertiary. So that's a lot of schools. It's a lot of schools. And so through SB1, they appropriated that the first 11 towns and the second 124 school sites. So a total of 160 schools would be eligible for funding for expansion of current school-based health center services, or new school-based health center services. And it could be for medical or mental health, or both. And so what does that sort of do for us? That really gives us a huge number, and it gave $10 million to the school-based line item, keeping in mind that it's ARPA funding. So it's for 1 year. And so what did it do for us? It first put us on the map, right? It made school-based health centers an intricate part of this puzzle, and really sort of highlighted the great work that we knew we do, but sort of validated that we are a big piece of this puzzle, and could be a bigger piece. And so now 160 school sites or parent organizations can apply for the $10 million. And part of what's a priority for this funding is that not only are you expanding school-based health center services, but that you have because it's a 1-year funding opportunity, that you have a significant, very well laid out sustainability plan. And that you can provide, priority will be given to sites that can provide after school, either before or after school, so expanded hours of operation at their site. And so that's really important when we talk about access, right? So we've put in telehealth services that increase access. We put school-based health centers inside schools that increase access. But we have always struggled with funding opportunities for before after school care. And part of the reason for that is it really takes some time to build. So that's sort of part of my concern, is that priority is given to sites that can put in after school care and services, but is that really sustainable? Because the first year you're really getting that information out to your families in your district, and sort of spinning the wheel a little bit. And so what happens after that funding's gone? That's always my concern, because I know, based on my experience, and I have been a director once upon a time and attempted this in a district, that you don't make money right away, right? And so your users are a smaller number, and it just takes time to build. So
Melanie, can we take just a quick step back? I think
sure.
Most of the folks here are familiar with the actual definition of a school-based health center, but I know when it comes to families and children and advocating for them in the school setting, folks might not know who's in charge of what. So can you just give just a brief definition of what a school-based health center is, and maybe what it is not?
Okay, so a school-based health center is a medical or mental health provider who goes into a school setting, is on a campus, and provides services. So we have an outpatient license, either through DCF or the Department of Public Health, and sometimes both. We provide primary care services, but we do not replace your primary care provider. We work in conjunction with them. We ensure that families who don't have primary care providers are provided warm handoffs and sort of handheld into a primary care facility. And so we provide anything, if you're talking about medical, we provide anything from physicals and immunizations to sick visits, anything you can think of. And then we do referrals. So we do referrals for specialty care outside of that. So just like you would go to your PCP, that's sort of how you think of us. But we are a visitor inside the school. And for mental health, it's just like going to a Brantford Counseling Center or to Yale Child Study for mental health services. Where we sort of have to draw the line is if a child has a mental health issue where they should not be in a school setting, that's a higher level of care. And so we would make those referrals. So we are very much outpatient clinics inside the school.
Right. And I think it's also important, Andy might get into this, but it's important to make the distinction that you don't replace necessarily the school social worker, the school psychologist. Each person has a different role to play. And if a child has an IEP, an individualized education program, that's all going to be serviced by the school professionals. And so you guys are just another level and partner.
Absolutely. We don't participate. We participate in PPTs if we're invited, but we are not written into the IEP plans. So yes, you're right. Absolutely. And we don't replace anybody in the school system. We work in collaboration. In fact, most of our referrals will come internally from the school system.
Right. And it's obviously the co-location makes it very accessible for children and families. And that's a huge piece of it. I wanted to quickly look at Eleanor's question. And I guess either Dr. Ponson or Melanie, either one of you might want to answer. What do you do if you are on the wait list? And what if you are someone who does receive school-based health center treatment, but that center is not open over the summer? So I guess let's start with Yann. Dr. Ponson, what do you suggest if you're on the wait list?
It's really bad. I would say it's really bad if you're on the wait list. What we're trying to do here is come up with a plan to come up with a fair way to address folks on the wait list. The short answer, there's nothing you can do on a wait list. I need a surgeon and there is no surgeon. The surgeon can't operate on two arms at a time. So the question is, well, what can we do for folks on the wait list? Can we give them strategies? Can we give them some kind of care? Can we have a parent meeting? So we're trying to come up with strategies to provide some kind of resources and information for folks on the wait list. How to access 211. Some families just don't know that 211 exists.
Right.
How to access the crisis text line. So we're coming up with strategies to try to help parents with some basic psychoeducation and information, and that's an ongoing discussion of how to do that. We have methods of prioritizing. So kids have been on the inpatient unit, intensive outpatient, ICAP. So we do try to prioritize those kids, but we also don't want to put aside others that need services and will just always be on the wait list too. So balancing that out is also an art form.
Yeah.
As far as this, I can answer, I don't want to tread on your area, Melanie, but I'm one of the supervising attendings for the school-based health clinic in Brantford, where we actually have child psychiatry too. And that is also a challenge. Usually what happens over the summer is the most kids with the most acuity and need ongoing support will usually get referred to another service because they'll need more support. But typically over the summer, families are, there's a process to try to support families through their pediatrician or giving them resources to access over the summer. At least that's how we do it on our end. But Melanie, I don't know if you'd like to add in terms of, I'm sure you can add in terms of what are some of the ways of thinking of kids over the summer.
So I always say that there's no one size fits all for school-based health centers. So Dr. Ponson is absolutely right that there are centers that do close over the summer, and then students who are high acuity are referred to other outpatient clinics for support, and those collaborations are made well in advance. And our providers work really hard with the new providers, and usually they're not new providers. Their students usually have some sort of rapport with that agency. Some of the other school-based health centers around the state stay open periodically through the summer, and so they will touch base with their students. It might be one day a week, it might be once every 2 weeks, but providers do touch base with their students. So I think that's always a work in progress. In the past, we have had school-based health centers that have stayed open all summer long, but we have a really, as with any other clinic, we have a really high no-show rate. So we try to support the students who are in high need the best we can.
Thank you. Yeah, it sounds like it's definitely a team effort. So I think we're going to Joanne and to Ray. I believe that your questions are answered in the chat, and also might be answered by the school-based health center report. So I believe that list would be found there. And does that report, Melanie, also have the demographics of kids that are being served currently?
So I can say that the expansion report yes. So the expansion report has the 11 towns, if you start on page 18, the 11 towns, and go forward from there, you'll find all 160 towns. And then there's some demographic information in there. But if somebody's looking for more, I can provide that.
Great. Thank you so much. I think we're going to try to move on to the education portions of these bills and talk to Andy Feinstein, but please stay tuned.
Kathryn, can I just message say that the one thing that I think went radically wrong with SB1 is that from a school-based health center standpoint, is that the urban areas did not meet the SVI criteria. And so a lot of the urban areas, as we know and we're reading about, have extremely high mental health needs as well. And so they fell into category 3 and have been left off the list for expansion of services. And so that's really part of what went wrong.
Is that due to the calculations of that social vulnerability index?
It's due to funding, really. So yes, they fall lower in the SVI, but when we went to calculate, we asked for $21 million, and I know that was lofty, but we did a cost analysis and thought, if we're going to do all of these schools, this is what we need. And so because they fell so low on the SVI, they fall off the mark.
And just to clarify, they fell low on the SVI. Is that because they already had a certain number of providers or a certain amount of access available theoretically?
It's a whole lot of everything. Yeah.
Okay. Thank you. That's really important for us to keep an eye on and to think about for next session. Really appreciate that. Okay, moving over to Andy, Attorney Feinstein here. So would love to hear your thoughts and your reflections on SB1, SB2, HB 5001, and a couple other smaller bills that you might want to address, particularly how they benefit the students that we collectively serve, and students with disabilities in particular, and what was left out of the equation.
Well, before I do that, it's really important, I think, to note the Federal Safer Schools Act, which is now moving, which contains a whole lot of money for a whole bunch of things. It's the provisions on mental health are enormous. New guidance on telemedicine, $60 million for training mental health professionals, $120 million for 4 members over 4 years to prepare and train community members and first responders on how to respond to people with mental disorders, $250 million for states to expand mental health services, $500 million for school-based mental health services and staff, another $500 million for school-based mental health service professional demonstration grants, $1 billion for Title IV-A student learning. There are provisions that we don't, that we're not very happy with, including an additional $300 million for school resource officers, and a clearinghouse for ways of pardoning schools, either of which it strikes me are going to be very effective. But in terms of,
yeah, I was gonna say thank you for pointing that out. We and we're following that along to see what the specifics might be. I'm so sorry, I wanted to quickly interrupt you because I wanted to acknowledge Representative Comey and Representative Nolan on this seminar. And is there anybody else? I think so far, but thank you so much.
let me move to the topic at hand, though. Although
back to Andy.
I do need to point out that what happened last year in the Connecticut legislature is being replicated in this federal legislation, which, as long as the 12 Republicans have voted on the motion to proceed, stay with the bill, it sounds like a very good chance that this is going to pass, and there's going to be a lot more money in the pipeline for school-based health centers and for school mental health professionals. So we have an unfunded grant program in 2 bills to provide grants for school-based mental health professionals. One of the big issues, of course, is that we look at school psychologists as if they're clinical psychologists. They're not. Most school psychologists spend most of their time doing evaluations and testing and do not provide counseling and support. Obviously, increasing the number of school-based health professionals can provide additional services, but we've got to be clear of the type of services that they need to provide. Another thing that the legislation attempted to do was to break down some of the walls between schools and community providers. Established folks who in each school whose job it is to build those bridges. In SB2, there's a requirement that each district have a family care coordinator to work with outside providers. That is continues to be a serious issue. Of course, telling people, working with outside providers is not really the answer when there are, as Dr. Ponson points out, a serious shortage of outside providers. There's one thing that was very important to us was relabeling the category of emotional disturbance to emotional disability. Emotional disturbance frightened a lot of parents. There were a lot of kids we dealt with whose parents rejected special education designation because they said, I don't want my kid walking around with a label that my child is disturbed. And so that change was made, and that in many ways I consider the most important breakthrough of the year. There are, again, as the legislature loves to do, a whole slew of task forces and working groups created to look at various issues. One that particularly captures my interest is Section 6 of SB2, tells the NEAG school at UConn to study the effects of social media and mobile phones on student mental health. I think that's a critically important issue. And I don't think anywhere near enough work has been done on that. I was at a PBT recently, and I asked for sixth grader and asked the principal, what percentage of sixth graders in your school have cell phones? And the answer was 90%, which strikes me as frightening. And the principal was quite clear that their ability to monitor use was a very, very serious problem. We continue to have issues which have not been dealt with despite efforts by you, Kathryn, and others to deal with the use of exclusionary discipline, where instead of dealing with kids who are having issues in schools, we throw them out, which, to my view, serves, no effective purpose either for that kid or for the other kids in the school. We continue to work on that through the Juvenile Justice Policy and Oversight Committee under the leadership of Representative Porter and others. I have
To that point, Andy, I wanted to get your thoughts. I know we see a lot of the same things in schools with the folks that we serve, which is, and what the mental health providers on this call have also talked about, which is increasing dysregulation with children in school. I guess I'd say particularly the youngest children, and couple that with a staffing shortage, huge staffing shortage. It's a pretty big recipe for disaster. So do you see this legislation helping to address that challenge at all?
No, I don't. I mean, I think that we need to take some very significant further steps in order to do that. And one of the issues that you and I face all the time is that the State Department of Education provides guidance and leads from in front, but doesn't tell districts what to do. And at some point, somebody's got to tell districts, don't throw out kids, don't punish kids, treat them, deal with them, work with them to create the responsible citizens we want in the future. Our work together on the JJPOC on that is in that direction, but unfortunately, we haven't made real progress in that. We did, pass legislation 7 years ago now to prohibit the suspension or the out-of-school suspension or expulsion of kids in kindergarten through grade 2, except in cases of violence or activities of a sexual nature. Despite that, the exclusion of young kids continues apace, and we see evidence of that all around us. And further, while you and I and everybody else in this field has seen an explosion in discipline this year, the Department of Education does not collect. They do collect data on it, but they don't publish it until October of the next year, and so we won't know for another 5 months how bad it was. That even to the extent that there's any validity to that data, and there's real questions about that. There are, a couple of specific interventions which cause some concern. There's new truancy interventions and a new provision that teachers can refer for behavior intervention plan, both of which are already mechanisms well in place to deal with that, and creating a new apparatus may be going in the wrong direction.
Yeah, I agree. I think some of those interventions were created with good intent, but they might be used to circumvent, particularly child find, which already requires districts to locate, identify, evaluate students who might have a disability that's impacting them in school. So we just want to make sure that those tracks are not running parallel, and that we're not using the other track to circumvent potential eligibility for special education.
And I guess the final thing I want to say, I mean, I'm glad to talk for the next half hour, but let me just stop here. It's all about money, you know, and there is no, Connecticut is quite unusual. There is no appropriation for special education in Connecticut. There's an excess cost grant for very expensive placements, more than 4.5 times the per pupil cost for the district. And the excess cost grant until this year has been frozen at 140 million for the last 12 years. It's now raised slightly, and the formula has been jiggered so that the 58 poorest towns get 76% of reimbursement, the 73% for the middle third, and 70% for the richest third of towns. But that doesn't solve any problems. You know, the fully fund excess cost reimbursement would take another $70 or $75 million, but that really just encourages really high-priced placements. What we really need to do is put money in to make special education, including the mental health portions of special education, part of what schools do and part of what schools do right. And so, you know, I would, there is, you know, as I said, a multiplicity of task forces. There is a task force on the provision and funding of special education that was established last session, that the previous session never created, but now it's reestablished, and I am told that it's real this time. Maybe we can look at that issue.
Something done there. Yeah, I mean, I think we'd agree that we want to invest in the spectrum of services available within the district, including mental health, to reduce exclusionary discipline and to help keep kids, you know, in their neighborhood school, if at all possible, to address their needs. That's a segue. You're talking about money. I'm going to segue over.
Well, let me one final point.
Okay, fine.
And look, as anybody who's been in the school knows, the primary adult that kids go to is the teacher, or maybe the para, or, you know, in some cases, maybe the janitor, not necessarily the mental health professional. And so it's not, so we should not silo this so that, you know, look at mental health only as the mental health providers in schools, even though we ought to be establishing more of them and training them better. But we really need to provide teachers with the support and the, you know, training they need to provide the sort of, you know, trusted adult counseling that every child needs.
Yeah, and that's a natural fit, like you said, and it's somebody who's interfacing with the child probably every day. And I think when you say supporting teachers, that's going to include more time in their schedule, you know, fewer kids to serve, and making it more feasible for them to also play that role, which could be a natural fit, like you said.
And one thing that did happen in this is that teachers are guaranteed a free lunch period on new legislation this year.
Yeah, well, that's one way to help support them, so
yep.
they
Yep.
can do their very difficult job. And yes, thank you, Rep. Porter. There is a provision in the bill about coaches and training coaches and making sure that they have the tools they need, because they are another natural fit for young people to connect with. I'm going to move on to George Sinclair, and we're going to have to put up his slides, please. And he's going to explain the thorny topic of school funding. And I'm not even going to do the outline for this. This is all George. So then after you share the provisions of the bill, and you can just let us know, you know, how the process went and what you're looking forward to doing for next session, George.
Sure. Good morning, everyone. Thank you, Kathryn, for having me. And thank you to Representative Comey and Nolan and Porter for supporting our efforts the past couple of years. So this last session, the 2022 legislative session, we worked on House Bill 5283, which was a proposal to fully fund ECS in FY25, fiscal year 25, to coincide with the expiration of ESSER funding. It's, as has been mentioned here this morning, Connecticut schools received over $1.7 billion in federal education funding in federal relief for COVID-19. If you could go to the next slide. Well, a little bit about our organization for those of you who don't know. The School and State Finance Project is a nonprofit, nonpartisan policy organization, and our focus is education funding in the state of Connecticut. You can go to the next slide, thanks. So a little bit of background. A couple years ago, our organization identified a racial funding gap between Connecticut schools that serve majority BIPOC students and all other districts. And over the last year, that gap has grown. I think when we first did the analysis, it was $630 some odd million. The last time we did the analysis, it has risen to $713 million. You can go to the next slide. Thank you. Yep. So, like I said, a little bit of context for what we worked on this last legislative session, in the 2021 legislative session, recognizing that racial funding gap existed and that disparities were exacerbated by the COVID-19 pandemic. Our organization proposed fully funding ECS immediately and enhancing the student need-based weights that are really the fundamental part of the ECS formula. And in the wake of the Congress passing COVID-19 relief aid, it wasn't really that urgent for us to fully fund ECS. So the legislature, rightfully so, chose not to do that, but rather to increase the weights for English learner students and for low-income students. And we also lowered the eligibility threshold for school districts receiving the concentrated poverty weight. And that was very helpful, as you'll see in the next slide. It extended that weight to 10 additional towns. Before, there was a 60% threshold. So if your student population was more than 60% concentrated poverty, you were eligible for this additional funding. But towns that did not receive that additional funding, like Bridgeport, East Hartford, New Britain, New Haven, West Haven, we know are districts that could use that additional funding. So that was a major positive step taken by the General Assembly. The legislature also began to extend the student need-based funding to different types of public schools. So in the state of Connecticut, there are 10 different formulas used to fund different types of public schools. And many of them just receive a flat per pupil amount. So the legislature began to extend that need-based funding to state charter school students, but not to magnet school students or students attending VOAG programs. So there was still, steps to take. You can go to the next slide, please. So that brings us to what we worked on this past legislative session. So we felt that, obviously the COVID-19 relief aid, the ESSER funding, was a huge benefit to school districts. But the one-time nature of those funds means that there's inherently a fiscal cliff, and that programs that school districts might create with those funds are, they may not be able to continue. So we felt that if school districts knew that they were going to receive their full ECS grants at the expiration of that funding in fiscal year 25, they could begin to use those funds for meaningful recurring expenses like hiring additional staff. The proposal maintained the current phase out schedule. So the ECS phase in, which in current law should be complete in fiscal year 2028, comes with a phase out schedule for districts that the formula defines as overfunded. So those towns would not have seen a change to their phase out schedule. So there was not a negative impact to those communities. A point that's not on this list, but was included in the legislation, was extending ECS weighted funding to school choice programs, so also magnet school students and VOAG students. It also eliminated general education tuition for sending districts. So what this means is that students attending a magnet school program, for example, from who are leaving a traditional neighborhood public school and attending a magnet school program, the sending district is responsible for that student's tuition. And for some districts who see a lot of their student population leave to attend a choice program, that can be a significant burden. For example, Hartford Public Schools, right? They see upwards of $20 million annually in tuition. So we felt that that shouldn't be the burden of another school district, and that the state should provide that funding. And it also created a task force to study education funding, accountability, and college readiness. So, I think that rightfully so, there were concerns raised by legislators and elected officials across the state of a large windfall in state aid to school districts. And there was a desire to study the state's current accountability measures and see how those could be improved to make sure that funding is going toward meaningful things to help students. So that's largely what we worked on, and we'll continue to. House Bill 5283 did not pass, but we believe that that the legislature could still pass a speed up of the ECS phase-in next session, and that could still have a meaningful impact to school districts.
Thank you, George. So seems like you got very close to the finish line, and I know you were heartened by those efforts and that progress.
We did, and we were extremely thankful for everybody's support. We had over 50 co-sponsors of the legislation. We had bipartisan support in the legislature, and a lot of support from community and policy organizations across the state, including SEEK and CCA. And we were very grateful for that, and grateful for the coalition that we got to work with, with education stakeholders from across the state. It was nice to see that collaboration and recognizing that all of these issues are interconnected in a variety of ways. So that was great to see.
Yeah, so what would you recommend if folks on this webinar are interested in supporting the efforts more and making our voices louder for next session? Where do you recommend people start? Certainly visit our website, and I'll share that in the chat here. We put together a statement of support, and a lot of people, a lot of organizations on this call signed on to that. We're putting together our plan for next session. So, I think the more people at the table, the better for that. And, feel free to reach out. We also do a lot of education particularly during the off session. So if there are folks on the call who want to learn more about education funding and school finance in the state of Connecticut, legislators included, we're always happy to do a school finance 101 as a presentation we do often in communities across the state. Thank you, George. And you guys have some pretty nifty slides, I have to say. So good work on making the information understandable and digestible. Thank you. So Rep. Porter, I just wanted to circle back to you because we started with you in this kind of juvenile justice context, but you are involved in so many other capacities of issues that we've talked about today. So I wanted to just give you the opportunity to comment on any of the education or mental health bills that we also discussed after.
Thank you, Kathryn, and thank you to the presenters. I mean, great job done by all, and some really good information and some great points that were made. And I think it just all goes back to what I think is the center of all of this, no matter which intersection you're talking about, whether it be, the juvenile justice, 5417, or education and mental health, they all go hand in hand. And I think the thing that really resonates with me with what's been said today is that we have to meet, the children and the educators and the stakeholders and the parents and the families, everyone where they are. And we can't hold harmless communities that haven't been harmed. We need to stop doing that. We need to make sure that we're taking funding and providing that funding and appropriating it in places, schools and communities and families that are in dire need. When we talk about and look at what this pandemic has exacerbated, because this is nothing new, right? It's deja vu on steroids, as far as I'm concerned. It's what we've already seen, but it is a lot bigger, bolder, and badder now because we didn't do the work on the front end. And I just want to express that, that is where I think the rubber meets the road. We really need to be addressing the prevention piece of it. The fact that Yann Poncin mentioned, he talked about several things that kind of triggered things for me, the demoralization around feelings of self-esteem, the pressure around social media, how they're presenting with higher intensity, disruptive behavior that's driven by trauma. And that is something that we haven't been talking about as much as I think we should, and addressing. Forget about talking, because we've been talking about this for a very long time. I think it's now to decide what is the most effective and efficient way to deal with it. How do we address it so that it has an impact that will bring about the outcome we're looking for? These children have great potential, and none of them wish to be born in communities that have the kind of issues that the children in my community have. That's not their choice. The fact that they have substandard education, that's not their choice. The fact that their childhood behavior has been criminalized, poverty has been criminalized, that's not their choice. So as adults, I think we do have charge and great responsibility around making sure that we're providing things that are going to be real. The devil is in the details. Melanie made a great point. I think it was Melanie that talked about how what went radically wrong was the urban school services areas didn't meet the SBI load. I mean, they can't even participate. And we're leaving out the children who are in the most dire need, the children that don't have the resources that other children have. We experienced it in my district around the digital divide. The fact that these kids were already behind when school was in, and then when school got closed due to the pandemic, they were left in the wilderness. And now we have children that are back in school 3 years behind. You have kids that are coming in to, whatever grade it is, but they've been absent for almost 3 years. And there's been nothing done to provide them with the issues that they're dealing with. And the mental health is real. And I'm glad that we were able to move the kind of legislation that we did. One step in the right direction is better than no step, but we have a long way to go. And I'm just really grateful for the folks that presented today and highlighted how we could get this right. Because at the end of the day, it's just about doing what's right, not having these knee-jerk reactions, not looking to pacify people to make them feel safer or to make it feel like we're doing something for children in the way of advancing them for their future. We need to be doing that for real. And like I said, the devil is in the details. And I think some of that has been revealed today, that even with the things we thought we got really right, there's still some insufficiencies that need to be addressed. So thank you for this.
Can I just add to that a little bit? I mean, the real scandal is that in Connecticut, a kid in Bridgeport or Hartford or New Haven has his education funded to the tune of about $14,000 a year, whereas a kid in New Canaan or Darien or Ridgefield has their education funded to the level of $22,000 a year. Why is that? And the urban school districts have a higher proportion of special ed kids, a higher number of kids on free and reduced school lunch, a higher percentage of English learners. we are starving those districts. The problem, of course, is that education in Connecticut is funded through local property taxes. And so, you know, our state equalization grants, which is what George was talking about, only make up a tiny bit of that difference. And, you know, what we really ought to do, I know it's politically impossible and to do it, but we need to do what Vermont did and eliminate funding of schools through local property taxes. Do it through state funding and fund kids the way they need to be funded, and fund kids based on what they need, not on you know, where they live.
Agreed. I think most of us would agree with that for sure. I wanted to circle back to Representative Comey, who had a question earlier in the chat, and I guess this would be for Melanie or Yann. What is the way that kids can transition from a high school school-based health center if they are moving on, if they're graduating, and what's the handoff like, I guess, to adult providers?
So our providers work with our students to ensure that if they do need services for mental health services, that there's a connection made prior to leaving high school. And if that means they're staying in the community, then they connect them with a community provider. If that means that they're going on to college and they've determined what school that is, then they will work with them to initiate that point of contact. So we don't initiate the contact for them, but we do sit next to them and we walk them through that whole process of, let's find out who it is and let's give a call and let's let them know what they, you know, that you're looking for services. And then if we need to have records sent because you're 18, here you go, here's that process and let's do it. And the same works for medical. We never leave a kid hanging. So we always want to make sure that they have a medical provider. And even if that means, again, if they're going to, if they're staying in the community, we connect them with a community provider. If they're moving to a different community, we work with that community. If they are going on to college, and then we connect them with the health services department and a provider up there if they need specialty services. But we sit right next to them and help them make the phone calls. Again, we don't do it for them, but we definitely start from the time they come into high school and they come into our school-based health center services. We start the process of taking on your healthcare needs and being an owner of that. And if that means that you're speaking up for yourself and you're advocating for yourself, or that you're making the phone calls with us standing next to you, sort of rubbing your back and making sure you have all the information, then we do that.
Thank you so much. Yann, do you have anything you want to add?
The warm handoff is very important where possible. I don't think I have much to add. Some kids are willing, you know, want to break from therapy. Some kids have insight that it's really helpful and they need to continue. Other kids have insight, they want to continue, they should continue, but they have a hard time following through even with the help. It's hard to establish a new relationship. It's hard to go from school to somewhere else. It's not part of your day anymore. You have to go to a place. So there are challenges around that for sure. But I think Melanie captured everything that is tried to lower the barriers.
Thank you. I wanted to just give the opportunity to Representative Comey if you wanted to speak or see if we were able to address your question.
Yeah, you know, I think that's a great, I think Melanie provided a great background on that. And, you know, I would imagine that, you know, what has happened in my experience is that, you know, they want to take a break for a little bit because they're looking forward to their summer and their new life starting in college. And then everything gets really overwhelming in college. And I find that colleges are not particularly poised to support students as well as our school-based health centers, and depending on where these the colleges are. For instance, if you're up at UConn, where I'm sure you have large numbers of people in a quieter area of the state, I would think that just a bit more difficult to be able to wrap services up there. But yeah, no, I thought it was a great answer.
Robyn, having a school, college age kid, I do agree with you that different colleges have different resources, just like different school districts have different resources. And, you know, kids are always encouraged that they can, if they have a relationship with a provider in school-based health center, just call them. You know, let them know that you're struggling and you're trying to find services wherever you land. And I don't think a provider, I've not heard of a provider in my 25 years, but that doesn't mean they don't exist. It just said, sorry, you're on your own. Welcome to adulting.
Wouldn't be very in line with the support of mental health, would it?
Absolutely, right.
Okay, so we're just about to finish up. I want to see if our panelists have any final words, or I could also offer Rep. Nolan. I don't know if you wanted to say anything, or just hi. Sure.
I just want to thank everybody for all the information that was talked about during this meeting. It was very well stated. I agree with a great deal of things that were talked about, especially in regards to special education, which is a sore that's in my heart because we haven't been able to do as much as I think we can do with that. And it all comes to the money. And I think we ought to, you know, stop investing in things that, you know, are not as important as our kids, and really bring some money to the table. We did a good job, I think, in the past couple of years, but I think we can do a lot better. And we need to shake some of that green off some other trees and bring it right to our children and make sure that we first take care of that ECS. I have words that I don't want to say about it, but take care of the ECS funding like we need to, and stop playing around, and stop leading people on with little bits and pieces, and then really hit hard on you know, the mental health and the special education, because if we don't take care of those, then we're going to take care of them with a larger increase of funding in other areas, and we're going to regret not taking care of it. So, you know, those are things that I think should really happen. I really want to thank you for putting all this together and wish you all a nice weekend.
I'd like to say something at the end. You know, one thing that we're really lucky about in Connecticut, and I'm looking particularly at the two Robyns, is that, you know, we have state legislators who are working year round on these issues, not just and then obviously Rep. Nolan as well, and there are a whole bunch of others who are, you know, in all these meetings, all these task force work, you know, working constantly on these issues. I know how pathetically you're paid as state legislators, and you know, you're certainly not getting paid for what you're doing. You're doing it out of public service and out of recognizing how important it is. And I think we in Connecticut really have to recognize that we've got some public servants, largely volunteer public servants in the state legislature, who are really moving this forward, really involved, and really making a big difference. And I thank them, and I think we all ought to be thankful for them.
Okay, Andy's trying to grease the wheels for the next session. And, you know, on that note, I think we're going to have to close up. Any other questions can be emailed to me, and my contact information is at the end there. Again, thank you so much to our panelists for lending their time and expertise. And, you know, let's just galvanize and get ready for the next session. And it goes on, right? The cycle goes on. I echo the thanks to all the incredible experts on here and look forward to working together in the next session. Take care.
Thank you. Bye, everyone.
Thank you.